Codes in the musculoskeletal subsection of surgery are used to report surgical procedures on the bones, tendons, muscles, and soft tissues. This subsection also includes codes for fracture care and for casting and strapping. The general codes 20005 through 20999, located at the beginning of the musculoskeletal system subsection, are to be used when a procedure cannot be reported with a more specific site code. Procedures in the rest of the section are listed from head to feet, with subheadings for type of procedure performed. Each anatomical subsection includes subheadings for incision, excision, introduction or removal, repair, fracture and or dislocation, arthrodesis, and amputation. Because of the similarity in sections, it's a good practice to double-check the subheadings to make sure that the code selected is from the correct anatomical site. Reporting modifier 50 bilateral procedure can be difficult in the musculoskeletal system subsection. The code should be read carefully when deciding whether to use this modifier. It should not be used when bilateral is stated in the procedure description. However, some procedures are inherently bilateral and their descriptions do not include reference to being bilateral. Wound exploration. The codes include surgical exploration and enlargement of the wound and extensive dissection to determine penetration, debridement, and removal of foreign bodies. The codes also include removal of any foreign bodies located during the exploration. These procedures do not include thoracotomy or laparotomy. When more extensive procedures are required to repair major structures or vessels, the codes for these procedures are used instead of the wound exploration codes. If only simple, intermediate, or complex repair of the wound is performed and wound enlargement and other exploration are not required, the appropriate codes for the integumentary system subsection should be used instead of the wound exploration codes. Excision including biopsies. These are codes for biopsy of soft tissue, and the coder should choose the code according to the site and should determine whether the biopsy is superficial or deep. Introduction and removal codes are commonly used for either aspiration or removal of fluid or injection of medication into a joint or ganglion cyst. The codes are specific to the size of the joint involved. Some practices may use codes for injecting tendons and muscles. Specific codes are provided for carpal tunnel, as well as some trigger points and other procedures. When a structure is injected, the physician first injects a local anesthetic and then he chooses a medication. The medication is coded using a J series of codes from HCPCS. When coding these medications with HCPCS, the coder must note the quantity of medications associated with a particular J code. If the physician administers an amount less than or equal to the quantity listed, only one code is used. The code is coded a second time for the second dose or fraction thereof. The same code may be listed multiple times depending on the dosages given. An alternative to listing the code multiple times is the use of units on the CMS 1500 form. Units are always expressed as whole numbers. Bone grafts. These codes are for obtaining bone, cartilage, tendon, and other tissue grafts from separate incision, and are to be assigned only when obtaining the graft that is not already listed as part of the basic procedure. For example, code 21127 includes obtaining the graft. Therefore, a second code describing harvesting of the graft is not assigned. Fractures. Codes in this section, subsection under the heading of fracture and dislocation relate to the type of treatment performed and not the type of fracture. This is an important distinction because closed fractures may require treatment that is open and/or involves percutaneous fixation. Fracture treatment can be closed, open, or with percutaneous fixation. Important definitions of terms used in fracture treatment appear at the beginning of the musculoskeletal system subsection. No incision is made in closed fracture treatments, whereas open fracture treatment does involve an incision. Percutaneous fixation is neither open nor closed. Instead, the fracture has a fixation device placed across the fracture fragments and through the skin. Usually this is accomplished with the assistance of an X-ray image. So for treatment of fractures, it is important to remember that the type of fracture, open or closed, has no coding correlation with the type of treatment provided. The expression reduction of a fracture is commonly used in the medical community, but the CPT classification system uses the term manipulation. When the terms reduce and reduction are found in the health record to describe treatment of a fracture, a code description of manipulation would be used. Manipulation is also used to describe the restoration of a fracture or joint dislocation to its normal anatomical alignment using manual force. Repair, revision, and/or reconstruction codes. There are several special definitions that apply when coding the repair, revision, or reconstruction of tendons. A primary repair is the first repair of any structure such as a tendon. A secondary repair is done at some time subsequent to the primary repair. And no man's land is the zone in the palmar of the hand between the distal palmar crease, or the crease in the palm closest to the finger, and the middle of the middle phalanx, or middle finger. The spine codes, CPT states that the term vertebral segment describes the basic constituent part into which the spine may be divided. It represents a single complete vertebral bone with its associated articular process and laminae. The term vertebral interspace is the non-bony compartment between two adjacent vertebral bodies that contains the intervertebral disc and includes two end plates. Bunion repairs. Codes for reporting bunion repairs are used to categorize procedures performed to correct a bunion deformity. These codes are used when the physician removes the medial eminence or the bump from the first metatarsal head of the great toe. The CPT book offers diagrams that assist you with coding and making your coding selections. Casts and strapping. This series of codes describe the application of casts and strapping that can be reported here. One must note if this is the replacement of a cast or strapping during the period of normal follow-up care or the global postoperative period, or to identify an initial service performed without any restorative treatment or stabilization of the fracture, injury, or dislocation, and to afford pain relief to the patient, or to identify an initial cast or strapping when the same physician does not perform or is not expected to perform any other treatment or procedure, and to identify an initial cast or strapping when another physician provided or will provide restorative treatment. Applying multi-layer compression system on various limbs is coded as 29581 through 29584. A multi-layer compression system provides therapeutic compression for the treatment of edema associated with leg ulcers and related conditions. Endoscopy means looking within. One must code to the site, such as the shoulder or the knee. Coder must also read the operative note and find out if it was determined if it was diagnostic or surgical. And what did the surgeon do during the procedure? The arthroscopy codes include codes for diagnostic arthroscopies in each anatomical site. When a surgical arthroscopy is performed, the diagnostic procedure is included and is not coded separately. When an arthroscopy, or viewing the joint with a scope, is performed with an arthrotomy, the open injection of a joint, both procedures are reported and modifier 51 is appended to indicate multiple procedures. This slide displays the internal anatomy of the knee along with debridement and meniscectomies performed through the arthroscope. The coder should read the documentation carefully to determine the extent of the meniscal work that is performed. HCPCS codes are used in the musculoskeletal system coding. An example here is codes that you will find in the HCPCS code book that you have. Many third-party payers reject CPT codes code 99070 for supplies because they require information on the specific supplies used or provided. A special durable medical equipment, or a DME provider, may be required to submit charges for more complex supplies and expensive equipment with a long usable life. Example would be a wheelchair and a custom-made or custom-fitted orthopedic appliance. Here we have a few examples that you can look up in your HCPCS book. Please review these with your CPT code selections in this chapter. Thank you.